Dr. Quinn, thank you for joining us today.
Hey, thank you for having me.
Now, lots of restrictions have already been lifted, and, things seem to be getting back to normal here in Mississippi. So are we ready to lift the official state of emergency, or should we still be cautious, or a combination?
I've been speaking with a lot of my colleagues, and I've been following the science. I mean, science through the news and the different reports. And we really need to really think this very hard. I mean, the bottom line is right now, there's a new variant. And I actually corresponded with Dr. Dobbs earlier, and he sent me this graph. But the bottom line is this new variant, the Delta variant, is in Mississippi. And right now, with this Delta variant, we're looking at 11 cases, which means it's here. And that doesn't mean that's all the cases. That's reported cases, because most of these cases of coronavirus, they're not identified for the specific strain. But it is confirmed that we do have the Delta variant here in Mississippi. And then we also have to consider that right now we have the lowest rate of vaccinations. So that puts us at a higher risk. So we really need to consider just holding off lifting those bans right now.
And Dr. Quinn, one of the reasons the governor is saying he's keeping the emergency in place is that so that the National Guard can still give out the vaccines. Is that how important is it to have the National Guard still involved in administering the vaccines in the state?
I mean, it's very important, because when you leave Jackson, Mississippi, and maybe the Gulf Coast, some of these more get out into the rural areas, like up in the Delta and where I'm from, like Macomb, there's less access. But with the National Guard, and I used to be in the National Guard, I did 13 years. It's an awesome organization. I used to work with a medical unit. We would go in and set up a whole hospital out in the field. Well, that's what the National Guard is doing. They're setting up vaccination sites in areas where there's very low access to medical care. And I've seen this firsthand. So we need to really keep that going, because it allows us to provide the access to people who otherwise would not get that access. And we can get people vaccinated, and we can get through this pandemic safely.
Dr. Quinn, Mississippi is dead last right now in terms of vaccinations. And, we sent a lot of doses back because we weren't using it, so we sent them to other states. Now, is this a hesitancy problem? And by that, I mean, are people just scared to take a shot? Are they scared of this shot? Or are this people just saying absolutely no, they're not going to be vaccinated?
I think what really, well, you know what I know for a fact, what really needs to happen is we need to continue the information. We need to continue information to dispel all the bad information, because I get so many patients on a daily basis that will come to our clinic and they'll say, I don't want to be vaccinated. And I'll ask them why. And I'll explain, the benefits of the vaccination, but then they'll tell me that they have heard that the vaccination will cause them to not be able to have children, just all very false. So the remedy is to educate, to let people know what's going on with these vaccinations, so we can ease some of that fear and hesitancy and go ahead and get these individuals vaccinated, so we can decrease the level of variants that are being spread among our state, and we can get through this vaccination, and I'm going to say in a safer way, because right now it's very dangerous here in Mississippi with such low vaccination rates. And also note, we have such vulnerable people in Mississippi, because we have so many people that have chronic medical conditions that are not, and that's why people are losing their lives.
Yeah, good thought there. Not only are we not vaccinating, but we're a state that really needs to be vaccinating. Thank you, Dr. Quinn. It's always good information. Thank you for joining us.
Hey, thank you.